Good day. This is Clinical Reasoning and Decision Making CRDM TAU NSC 408. I am Abiodun Omotayo Fatukase. Introduction to Clinical Reasoning and Decision Making. Clinical Reasoning and Decision Making CRDM is a cognitive process used by healthcare professionals to assess patient needs, diagnose problems, and implement care strategies. It is crucial for safe, effective patient care and encompasses theoretical and practical perspective. Background and importance of clinical reasoning and decision making. The significance of CRDM has grown over time and to the increasing complexity of healthcare. This course addresses the historical development, structure, framework, and steps involved, and highlighting the role of CRDM in patient safety and quality care. We have some definitions in CRDM. The two most common definitions that we are going to deal with are clinical reasoning and that of decision making. What is clinical reasoning? Clinical reasoning is a cognitive process to gather and evaluate patient information for diagnosis and intervention, while decision making is selecting the best course of action from alternatives based on evidence and clinical judgment. Let's talk about the history of CRDM. CRDM has its roots in empirical practices involving into structured evidence-based models. Its history includes contribution from nursing theorists and the development of framework guiding clinical judgment and decision making. Also, we'll be talking about the clinical reasoning and decision making circle. Under this circle, we'll be talking about collecting cues, processing of information, problem identification, establishing goals, decision implementation, and evaluation of outcome, and reflecting on the processes. The circle is represented by a diagram here. Also, we'll be talking about the strategies for clinical reasoning. Some of the strategies is one, healthcare professionals use strategies such as hypothetical deductive reasoning, pattern recognition, and heuristics to make informed decisions. Adapting this method to the complexity of patient scenarios. We have domains of CRDM. The domains are grammatically represented here. The clinical reasoning, evidence-based history and examination, choosing and interpreting diagnostic tests, problem identification, and shared decision making. Attributes and core skills of CRDM. Attribute, we'll be talking about the critical thinking, reflective practice, diagnostic expertise. While the core skills, we'll be talking about analytical thinking, communication, and judgment. What are the factors influencing CRDM, that is clinical reasoning and decision making? This course will be dealing with factors influencing this CRDM, such as patient factors, clinical environment, and professional factors. Under the patient factor, we'll be talking about age, commodities, and preferences. While under the clinical environment, we'll be talking about resources, and time constraint. While professional factors, we'll be talking about experience and knowledge. The framework and models of CRDM will also be discussed. We have models such as nursing process model, Turner clinical judgment models. Under the nursing process model, we'll be talking about assessment, diagnosis, planning, implementation, and evaluation. While Turner's clinical judgment model, will be talking about noticing, interpreting, responding, and reflecting. What are the clinical pathway and guideline? Under the CRDM, we'll be talking about clinical pathways and guidelines such as algorithm, clinical pathways, and guidelines. Patient engagement and shared decision making will also be discussed. In this CRDM, modern healthcare emphasizes patient engagement in care decision, while the shared decision-making ensures that care aligns with patient values and preference, promoting patient autonomy and satisfaction. Conclusively, this course, clinical reasoning and decision-making, will help to equip healthcare professionals such as student nurses with critical thinking, decision-making, and clinical judgment skills. Understanding these framework strategies and patient engagement will enhance the quality of care and promote effective clinical practice. Some of the references that the student will be making reference to are listed there. Thank you. We'll be discussing it further in the actual class. Thank you once again.